Welcome. Hi, everyone. I hope you're doing well. My name is Samia Kazi, and I'll be facilitating the webinar today, Curriculum Standards, Coronavirus and Emergent Curriculum. I want to thank you all for joining me today. We have about 70 wonderful participants, but we still have a lot more to join us today. I want to remind you that this session will also be held in Arabic. So if you've registered for the Arabic session, we will be hosting that in about 2 hours from now. So just a reminder. Thank you all for joining us today. Let's get started. We have a lot of fun stuff to cover today. So first of all, a little bit about myself. My name is Samia Kazi. I am a board member at Arabian Child. I have a doctorate degree in early childhood leadership and policy, and my specialty is in quality assurance systems. I'm a board member at a nonprofit early childhood program in the US called Ellis Memorial. Ellis is a preschool that has been in Massachusetts, in the USA, for about 140 years. It's known to be one of the top quality childcare centers in the States. I'm also the regional director at Childhood Education International. It is a nonprofit organization in partnership with UNESCO based in Washington, DC. So that's a little bit about me. And as you know about Arabian Child, we are an accredited training center. We've been around for 10 years, and we have about 90 plus training programs. Below are some of the logos of our international and local accrediting bodies, but we have different programs that are from a range from professional development training to vocational certificates, and all the way to qualifications as well. Okay, so today's focus areas. You'll notice from the title, Curriculum Standards, Coronavirus, Emergent Curriculum. So we have really three big keywords to talk about: quality, curriculum, and then what is emergent curriculum? And in the midst of all of this, what is coronavirus and what does it have to do with emergent curriculum? Well, hopefully we'll introduce all of these three big keywords to you today, and we have really an exciting webinar for you. Okay, so before we get started, let's do a quick polling exercise. You will see a list of questions in front of you. So if you can go ahead and look at the questions, there you go. So you should be able to see 4 questions. The first question is your center accredited? So do you know that your center has any local or international accreditation? So that what I mean by accredited is like a quality accreditation. So you can click yes or no. The second question is your center accredited by Jodha? So Jodha is an international quality assurance program. So you can let us know if your center is accredited by Jodha. So you can click yes, no, or maybe you don't know. The third question is that, do you think that being accredited will help you get more registrations? Do you think that it helps you better to convince families to increase number of registrations? What do you think about that? Yes, no, I don't know. And the fourth question is, do you know what level of quality your center is? Now, your program may or may not be accredited by Jodha, but if it isn't, why don't you make a guess? If it were up to your gut feeling, or you may have an accreditation or a quality rating from another program, you can make an estimate there from 1 to 5. So 1 being the lowest and 5 being the highest. So I'll give you a few more seconds to complete your answers. And then if I could ask Zubina, who's coordinating, if she could show the results of this poll.
Yes, sure.
Okay, I don't think I can see the results of the polling, but maybe we can see that a little bit later. Okay, here we go. So is your center accredited? Wow, 80% of your programs have an accreditation. That is amazing. 22% have the Jodha accreditation. Half of you don't know if you have the Jodha accreditation or other. Wow, 81% of you believe that if you get accredited, that will help you with registrations. And almost half of you think that you believe that you are offering a 5-star. That is amazing. Congratulations. 35% a 4-star, 22% a 3-star. Well, thank you for that. That is, I want to congratulate you. Thank you for providing such quality early childhood to our children. Okay, let's keep going. And the next question, I'd like you to notice the chat feature that we have right now. Make sure that you've selected all people, right? When you are putting in, I want you to answer this question. What do you think the difference is between accreditation and the ISO certification? What do you think about that? So the ISO certification, if you don't know what the ISO certification, that's okay. You don't need to answer in the chat. But those of you who do know, what do you think the difference is between a quality accreditation and the ISO certification? Okay, so Janet, hi Janet. Janet thinks that ISO is the basic standards of quality, right? Basic standards, but the accreditation have higher standards. That's one way of putting it. I think you're right. Hi Penny. ISO is very specific to one subject, for example, health and safety, but the accreditation looks at all areas. So nice to see you, Penny. Okay, and ISO for International Standards Accreditation, and the accreditation can happen within your area. So you have the ADIC and the KHDA, okay? No, thank you. I think that accreditation is as per the standards, right? So I think that, thanks Taru. Hi Taru, how are you? Okay, so I think that many of you are right. ISO is a certification that's given if you have a lot of administrative policies and procedures in place. So once, if you have the ISO certification, that means basically that everything that you do is written down, and everything that is written down is what you do, right? So that's basically what the ISO certification is all about. So meaning that you have a detailed process, detailed policy and procedures in place, explaining what you do, and what you've written down is truthfully, a description and a truthful representation of what you do. So that's what the ISO is. But usually the accreditation looks much further than administrative paperwork. accreditation looks like, as you've said in the chat, that looks at all different domains of quality. And we're kind of gonna get a glimpse on that today. So a really difficult question is, what is quality in the early years? If you've done research on quality in early childhood education, like I have for years, you know, you can look at so many different theorists, so many different approaches to quality, and not to scare you. I mean, this is just one of the mind maps that I was doing part of my thesis, just looking at the different definitions of quality from the different sectors, from manufacturing to business to, there's just so many different definitions and approaches to quality. It can be really confusing to kind of set a standard or say that, okay, you know, if I have in a childcare center, or if you have 10 different types of mathematical, you know, resources, then you're a 5-star. But if you only have 7, then you're a 4-star. Well, it doesn't really work like that, right? Doesn't it? So if you look at quality, it's much more complex. It's not only at the level of childcare, but there's a lot of other kind of levers that have to connect with each other in order to enable childcare directors to provide quality. So you'll see that I've highlighted curriculum and assessment as yellow, because that's the area that we're kind of talking about today. But there's so many different other levers that have to go together. So the quality of the teaching and how actually teachers use that curriculum, use those resources to teach, the pedagogy, how they actually, the approaches that they use to help children or to facilitate learning, their professional development, the financial mechanisms, the financial support that we provide childcare centers, the linkages to school, community, health settings, family and community engagement. You know, many of you, I can see from the chat, are childcare directors, and you know how important it is to engage with the family and to engage with the community. And I'll talk a little bit about that through the curriculum today. But also it's about governance that includes not only at the level of your childcare center, but also at the level of the government. The policies and program regulations and inspections. So you'll notice that if I were to count all of these, I think there are about 8, right? So what happens when I take away just one? So if I take away one of those 8 levers, it's 0. So you really, all of those levers have to work together in synergy, together in partnership, in order to enable programs to provide high quality. So it's a quite complex system. But an easy way to simplify it, if we go down to the childcare center, we know that quality standards can be categorized in 2 separate categories. So we have something that's called process quality features, and we have structural quality features. And so let's take a look at those together, what those mean. So you'll notice that over here, the box right here in the middle, you have these kind of orangish or reddish boxes. These are structural quality. So this means the classroom ratio, group size, the environment, meaning environment, I mean by tangible, physical things that are inside the environment, meaning the resources, the toys, the equipment, so on. Teacher qualification, teacher experience, all of these are structural quality features. Then if I go over here to the right under the yellow boxes, the process quality features include teacher-child relationships, pedagogical approaches, meaning the teaching approaches, collaborative crafting, means the teamwork and collaboration and partnership amongst the teachers themselves, teachers and teachers' assistants. So the team itself, how well they kind of work together, how well they sync together. So you'll notice if you kind of step back and reflect on these 2 categories, they're very different. The structural quality features are something that I can measure almost mathematically, right? But the process quality features is something much more complex. It's something that I really need to have a high level of experience and expertise in early childhood education and what it means to observe quality in order to be able to measure these process quality features. So if I put them together, right? If I put these together, the structural quality and the process features all together in this box, in this beautiful box, right? If I had an arrow that went right over here to the right, then I am enabling, I am helping childcare programs, I'm helping nurseries, I'm helping preschools, I'm helping kindergartens to achieve these beautiful outcomes. I'm helping them raise, multilingual children. I'm helping them raise healthy children. I'm helping them raise happy, mindful children. I'm helping them raise STEM skilled children, right? So these are all the beautiful outcomes. But I want you to kind of take a step back and look, what are these four things over here? So you'll notice that there's four things that are affecting all of these quality features that I have in the middle, and they are funding support. So what kind of funding support is the government providing us? What kind of community resources are available for childcare programs? The level of parent awareness and their appreciation of the importance of play-based early childhood education. Also, stronger partnerships between and among government agencies and between the government and civic societies or governments and private sector. Okay, so I'm going to get into the fun stuff soon, but I wanted to show you this kind of big overview of what the system or those levers would look like for, and to help enable programs, nurseries that to provide quality. Okay. Now, so for those of you who don't know, I want to introduce to you Jodha. Jodha is a part now of a nonprofit organization based in the US. They offer accreditation of childcare programs. So there are 6 domains that Jodha look at. And now keep in mind that I just showed you what the process and structural features are. And within Jodha, they measure all of those. So they measure in domain 1, they measure child learning and development. They look at the child protection, health and safety standards, program, the workforce qualification, professional development. They look at your partnerships with families and community. They look at your environment, and they look at the leadership and management of the program. So today, I'm going to go back one slide here. We're focusing on domain number 1, right? So the title of this webinar was Curriculum Standards. So curriculum really falls into domain number 1 under child learning and development. So what we're going to be doing is we're going to be dissecting domain number 1. I'm going to dive into domain 1. I'm going to look at some of the quality standards in domain 1. We're going to focus on the curriculum standards, and then I'm going to link that to what teachers can do today if they're reopening, or what they can do with using the coronavirus as an emergent curriculum. So that's our big objective for today. So just a reminder, as in if you do have, this is what I was talking to you about, the 5-star level. Jodha certification does have a 5 level tier. So today I'm going to be hopefully covering 14 specific standards for the curriculum. So there are a total of 64 standards in Jodha that you have to meet. And each and every one of those 64 standards, you have 5 levels. So there's 5 levels to them. There's a level 1 to that standard, and there's a level 5 to that standard. So if you achieve a 5 out of 5 on all of the 64 standards, then you're able to maintain a tier level 5 certification on Jodha. Okay, so let's kind of explore, before we go into the 14 standards for the curriculum, I want to talk to you about what emergent curriculum is. So emergent curriculum it's a philosophy of teaching, and it focuses on making, creating a curriculum that is in response to the interests and ideas and thoughts of the children. So emergent means something that is coming from experience. It's coming from the experience and the daily lives of young children. So now you're kind of connecting why it was so important that we talk about this kind of curriculum in alignment with COVID-19, isn't it? So the role of the teacher is to thoughtfully really listen and understand what the interests and what the experience and what the children are going through. And then that kind of helps guide the teacher how to plan and how to choose the next direction and how to kind of where to take the curriculum, right? Let's see a little bit more about emergent curriculum before we get into the standards. So if I know that a lot of us are, especially with teachers, we're thinking about, okay, how can I plan the curriculum? I want to plan a curriculum that I will bring to the children, right? So when we talk about bringing a curriculum to the children, we're not thinking about a process. We're kind of thinking, okay, first we're going to do this, then we're going to do that, and then we're going to do this, right? So, and then it's all of this coordination that happens. And I know that teachers spend a lot of time, and they do this so beautifully, is that they coordinate between what they're going to use, where they're going to focus in the environment, what kind of materials, what kind of tools I'm going to use, and then I'm going to take them outside, then I'm going to do this, right? And that's just wonderful. I'm not saying that any of that is to be disregarded. All of that effort is just beautiful. Just keep doing that. But when we're talking about emergent curriculum, it's a little bit different, because we're not really setting up, we're not choosing what exactly they're going to be doing minute to minute. Instead, we're setting up the environment. We're setting up the environment to create opportunities, right? To create opportunities for children to touch, listen, experiment. And then the teacher, there's a lot of documentation also that goes on, because the teacher is learning how the child is responding, how they're reacting to that and to those resources, right? So this might include, like, the teacher may have pictures of children, they may have questions that they want to ask, they may have, and then once they have these resources for the kids, they come in and ask questions, and then they see how the child responds, and they kind of, I don't want to say go with the flow, but it's kind of trusting your instincts and the instincts of the children together. And I know that it's a very different process to kind of pre-planning curriculum, because it emerges. It might surprise you, right? It's not something that you planned for. You can, however, plan for different possibilities. You could plan for different places to kind of facilitate and kind of strategically guide the children. So I think that it's very relevant that we're talking about that coronavirus is really, it's not something that anybody planned for, right? So it's kind of emerged. It's now become part of the experience that the children are going through, right? And it's changing all of our lives. So here in front of you now, you can see the different areas of the Jodha curriculum standards. So if you were to kind of dive in to domain number 1, and this is not all of the standards that are in domain number 1, but I've kind of extracted the ones that are specific to the curriculum. You'll see those in front of you. So you have opportunities for expanding vocabulary. You have teachers, how they encourage the use of language. And I've kind of tried to shorten all these standards so they can fit in these fun boxes. Use of books with kids, using a wide range of learning opportunities, individualized attention, positive transitions and waiting times, opportunities for free play, gross motor activities, positive staff-child interactions, peer interactions, and positive discipline. So something interesting you'll notice if you haven't been through the Jodha program is that you'll notice these letters right after these standards. So let's look at this one because it has all three letters. There's a D, there's an O, and there is an I. So what that means is that when you're registered and part of the Jodha program, you will have to meet all of these different standards, right? So how does the assessor verify that you've met this particular standard? Well, they verify it using these three ways. D means documentation. So meaning that the Jodha assessor will need to see what kind of documentation, what policies, what documentation, what reflections, any kind of documentation, curriculum documentation that you have to verify or to prove that you are meeting this particular standard. So D is for documentation and O is for observation. So meaning that the Jodha assessor will actually come by and observe the program and make sure that you're implementing this standard. And the I means interview. So we interview, that may mean interviewing teachers, that may mean interviewing parents, interviewing childcare leaders, or all three put together. Okay, so now let's get started. We're going to hopefully cover all of these different standards, and we'll talk about how teachers can implement these standards and keeping in mind the theme that we have with the coronavirus. Okay, so opportunities for expanding vocabulary. So I know that if you had looked at this standard pre-COVID, and now, even before I show you what's on this slide, I know that you know what's going to come next. I know that you know exactly that our vocabulary has changed. So if you look at, I was just looking at an article in New York Times, they've actually added new words to the dictionary because of the experiences that we have been going through for since March. So there's a lot of vocabulary that is changing. Pandemic, quarantine, disease, social distancing. And then really that goes hand in hand with the vocabulary, not only for the actual concepts, but also a vocabulary that is to do with feelings, doesn't it? So I want you to consciously think about that before you're with your kids, whether that's in a home or in a childcare program. Think about all of these new vocabularies. If you keep them fresh in your mind and kind of think about what these new vocabularies are, then it will help you to use them while you're going on in your day with kids, whether that's in home or the program. The second standard is how teachers encourage the use of language. So I know that it's very important that as parents or caregivers, we need to talk more with our kids. We need to help vocalize their speech. I don't know what happened with all of the letters, and it looks like something is messed up, so I'm sorry about that. So we need to have more lengthy conversations. We need to talk through the routines with our kids and comment on our children's actions. Like, Layla, you're practicing social distancing, or you're getting rid of all those tiny little germs when you wash your hands. Commenting on children while they're going about their day not only addresses the stress and anxiety that they may have, you're encouraging the use of language. You're helping them build that language. Labeling things around the house, around the childcare program. All of these are really good tactics to help encourage the use of language. Introducing objects that are of interest to children. I mean, you can still bring if you're in a childcare program, or if you're in and around your home or outside in nature, you can find different objects that that may interest children, and just take time and talking about it and being excited about different things, and talking about that object, the features of that object, whatever that may be. Ask questions. And I want to pause a little bit here, because it's important that we pause for answers. My supervisor in my master's and doctoral degree, if you've ever been in a class with me before, I've talked about Dr. Clifton Chadwick before. May he rest in peace. He was a fantastic supervisor and a mentor to me throughout my graduate studies. And something that Dr. Clifton always said, by the way, he was a very skilled psychologist, and he wrote a book about critical thinking. So if you're interested in teaching children critical thinking skills, so that's the name of his book, I really encourage you to go to Amazon, buy the book. It's absolutely wonderful. So what Dr. Clifton used to tell us, that it takes a person an average amount 6 to 9 seconds to really deeply think about something. So I want you to think about that when you're asking children questions, or when you're engaging with them in different conversation. Don't be afraid to take that pause. Allow those beautiful brain cells and those brain connections to fire up, and allow them to think about answers. And then whatever they answer, you can then use whatever simple words or sentences that they happen to use, depending on their age, of course, or developmental abilities. That you can enhance those. You can enhance those sentences. You add complex grammar, add rich vocabulary, expand on what they're saying. And of course, reading multiple times a day, and don't underestimate the few moments that you can, a few minutes, 15 minutes a day, if you can encourage between the childcare center or at home. It will make a world of a difference to these kids. Using gestures and signs. And I know that now you're kind of looking at all of these and you're thinking, man, COVID-19, how am I going to do all of this? It's just so stressful. Look, it's possible. I don't know if you were with me. We had last month, we had a 3-part series. We looked at childcare standards for reopening, and I invited the Chief Operating Officer of Ellis. Ellis is a preschool here in Massachusetts, and they opened about a month ago. And they did it, and Lauren, the CEO, was talking about her experiences. So I know that the sessions are in Arabic, but Lauren was talking in English. I was translating. So I encourage you to go to our website and watch those sessions, hear her out. So that you can, if you are planning to reopen, that hopefully listening to some of the comments or feedback that Lauren gives you will help ease the anxiety that we all have. Music, don't underestimate the use of music. Music can also help, and I'm not talking just about fun music as well. I mean, even other kind of soothing music, although it doesn't encourage use of language, but that kind of really helps lower anxiety, and not only in the children, but more importantly in the teachers and the adults, by the way. There's also great books. So we're going to standard number 6, and you'll notice that I started on number 4. So I'm sorry I didn't mention that, but we started at number 4 because I've only selected the standards within Jodha program that are directly related to the curriculum, because that's our focus topic for today. So these are some links to some great children's books that are available. They're free, they're digital, you can print them out. The links are over here. We will copy and paste and send you links, but you can easily even put the titles of these books and print them out. I know some programs in Arabic also, they've went in and wrote on using different languages, helping parents at home who speak different languages. They've written them or translated them. So there's a lot of things that you can do to help bridge that gap. But these are just some of the books, and I'm sure if I ask you, I'm sure that you've also found some fantastic resources as well. Okay, so next one is using a wide range of learning opportunities, meaning means holistic, meaning that we're not just talking about language or math, but we're talking about looking at the child as a whole. We're looking at all of these all put together. So we can help children develop fine motor skills, right? By practicing putting on, taking off the mask without touching the cloth part of the mask, right? We can help with language, going back to language again, labeling children's mask, maybe with permanent marker, encouraging children to read or recognize their names. We can incorporate health and safety, explaining the importance of a mask and how to protect, how wearing a mask is actually protecting other people, right, from getting sick. Social, so we can talk about more about children about people who can't wear masks, for example, due to other conditions like asthma. What about social emotional? You can praise your children for wearing masks. You can put a mask on stuffed animals. I want to pause a little bit on stuffed animals because if you were with me last month on the childcare standards, we talked about the stuffed animals were one of the resources that will be removed from childcare programs because they can't be easily washed, right, or disinfected. But putting a mask on a stuffed animal that we have in an entrance or maybe in a cabinet or high up outside of the reach of people is a great idea. And I think that it brings a lot of softness and a little bit fun approach to a very difficult challenge that we're all going through. Drawing a mask on a favorite book character, or allowing your child to choose their mask, one that matches their dress, for example. Maybe that's something that you can encourage parents to do. Letting your child choose their own container to store their mask when they're not wearing it. So bringing a little storage container to the childcare program, or even keeping it at home. The reason I have that under social emotional is ownership and seeing something that's to do with belonging. So having a space for children, having some area, and that's one of the reasons why we talk about the importance of having cubbies, having a space that belongs to them, maybe has a special picture on it or a name or like a little drawing on it. That kind of sense of belonging is really important to kids. And all of that, all of these things that I'm talking to you about is not only curriculum, but it's also, when you think about it, helping to reduce stress and anxiety and help manage that. So what else? Also, when we're talking about wide range of learning opportunities, that extends to parents. So we need to do a lot to prepare parents. Ellis, the preschool here in Massachusetts that opened last month, they actually prepared a little booklet for parents to read with their kids. It was a little story to help manage their expectations. So it was a little story like Layla is going to come to nursery, and this is that she's gonna Miss so and so is going to guide her. And it was a little storybook to kind of prepare them on what they're going to expect from this new normal when they come back to the childcare. So it's really important that we talk to parents and we tell them that they need to talk to their children about how the school will look, how the desks are maybe apart from each other. Of course, for older kids, and younger children won't have desks. So I know another program that I'm working with here in the States for the little kids, for toddlers. They have little stickers. They don't have desks, but they have little stickers on the floor. And can you imagine that the kids have gotten used to playing on those different stickers. So if a sticker is taken, they will crawl over to the empty sticker, and that's how they were managing social distancing. I mean, really, this is mind-blowing. What we're going through is just mind-blowing, but also, you know, our reality as adults is very different than the reality of kids. Kids are adapting. Kids are more adaptable, they're more flexible, they're more resilient than we are. So that's that. I mean, those dots, those sticker dots story was absolutely fascinating to me. Talking to children about how the interactions with the classmates will be different. And you know, and encourage parents to find out how their kids are feeling, and just telling them constantly that this is absolutely normal. Encourage parents to anticipate behavior changes with their child. Watch out for excessive crying, irritation, worry, sadness, unhealthy eating or sleeping habits. And encourage parents to attend school activities, of course, virtually, right? But the more engaged you have parents and the more involved you are with the parents, actually, you know, transcends and affects the stress and anxiety with the kids as well. Individualized attention. It was important before, and now it's just so much more important that we give individual attention. And we need to understand that COVID-19 is affecting our kids differently. You know, changes in routine. Kids are completely disrupted with their routines, right? If you ask me, which I'm not going to even tell you about what time my kids go to bed, I have 4 children, from babies all the way to teenagers, and I think that after the baby, I think the parents are the first ones to fall asleep. The teenagers, I don't even know what time they're sleeping. I mean, there's a complete shift in routines, isn't it? Free play. I mean, of course, before the kids wanted more time to free play, and now they have way too much time, and now they don't know what to do with all of the time for free play. So that whole dynamic has completely shifted, right? Our outdoor activities. Not all of the kids have the luxury of having outdoor activities. Parents working from home. Hello, us, you know, we're all working from home. That is completely shifted and is affecting, that stress is not only affecting parents, but it's kind of going through us and going to the kids as well. We need to give our children positive attention. We need to focus on their efforts. Make it intentionally, make personal remarks. You know, comment, get to spend more time. If you are reopening, I would spend more time learning about them, learning about their family, when I make remarks about our children, talk about, you know, certain experiences that happened in their home, talk about something maybe they have a new pet. I'm going to stop here a moment. I'm going to go back about 7 or 8 years ago. My eldest daughter is mildly dyslexic, and in grade 2 or grade 3, she was having a terrible time in the classroom. She was the lowest achieving child in the class. She had a really difficult time reading. She had a really difficult time comprehending paragraphs, keeping up with her fellow classmates. But God bless her soul, she is one of the most sweetest and kindest, and very very socially and emotionally intelligent little girl. So I had a chat with her teacher, and he was a male teacher, and I talked to him, and I told him about Noor and about the condition, about the challenges that she's facing. And he asked about Noor, about things that she likes. And I told him that she really likes that, give that little bit of a special attention. And she recently got a pet cat, okay? So what happened is, then the next day, the teacher, he asked me to send him an email of a picture of that cat. So I did. I really didn't know what he was going to do with it. So when Noor went to school the next day, she found that the teacher had printed the picture of the cat and had placed it on the wall on the entrance of the inside the classroom. Not only that, is that he switched his chair, which was it was not too different than all of the kids' chairs in the classroom, but it was a little different. I mean, none of the kids had little arm rests, but his chair did. Basically, I think that was the only difference between them. So he switched and he gave Noor that chair. That dramatically, and I'm telling you as a parent, dramatically changed the way Noor experienced grade 3. Really, so those two little things, that individual attention that he did, helped her manage the stress. It was such a simple thing that he did, but it would just completely changed her experience for the whole entire year. Okay. Also, I'm going to kind of jump forward to number 9, positive transitions. Transitions, I know that you know that transitions refers to change. So when we talk about transitions, we're talking about, it may be transition between activities, it may be transition between multiple settings, right? And maybe transitions between programs. But today I'm talking about transitioning back to a childcare program, transitioning back, with all of these new standards. And the reason why transitions the reason why it's so important to address transitions between activities is that children really spend a lot of time waiting. One of the standards, or one of the checklists or assessment criteria that Jodha assessors have is windows of opportunities lost. And this is actually exactly what it says on their assessment criteria, is that how many lost opportunities did the assessor witness, or did the assessor observe in a childcare program? Because children's just spending time just waiting in a line, or waiting to do something, or waiting their turn, that's just a waste of time, right? So we need to really think about transitions, and that can add to stress and frustration. Waiting for your turn really adds, I want you to think about waiting for your appointment at the dentist. Probably waiting for the appointment at the dentist is worse than the dentist itself, isn't it? That waiting period makes your mind kind of think and remember about all of those stressful situations. And during transition time, children spend time, they may wait for the bus, or wait for their snack, or I want you to consciously think about those transitions. So I'm sure that transitioning back to school, having conversations between children, and encouraging children to get back to a good sleep schedule, right? This is on my to-do list. Before my kids go back to school, a couple weeks before, I don't know about your kids, but my kids go back to school on the 16th of September. So I'm planning, let's say 1st of September, I'm going to start back with, instilling good sleep schedules. Yes. Discussing emotions. So all of this is helping them to kind of transition back to school. Making a storybook of expectations. Remember, I was telling you about the program that I'm working with at Ellis has made a little storybook of expectations and has given it out to parents. Maybe that's something that you can work on if you're preparing to reopen. And then using visual cues throughout the childcare center. Also, look at the number 2. We're already at number 10. I'm sorry, I'm hurrying a little bit, so I'm hopefully going to do a few more. We have opportunities for free play. So there's lots of things that we can do for free play with all of this that are safe, right? Coloring, drawing, gluing, reading and looking at individual books, gross motor activities as well. I encourage you to look at this website. Cosmic Kids Yoga has wonderful activities for kids that can be used in preschool. And what I'm going to do is I am going to shift a little bit, and I want to talk about this very important um, piece over here, is going beyond the nonverbal and verbal communication. And I'm going to end with this before I look at some questions that you may have. You know, standards is just not everything. And that's something that, you know, when you there's a book called Beyond Quality that I encourage all of you to look at. There's something that goes beyond checklists and beyond standards and beyond assessment criteria, beyond curriculum, I need to do this, and how many resources and toys. And that's something that is really something that is even beyond, it's intangible, and it has to do with energy. It has to do with your energy and your, I may be able to say even the spirituality. And I'm not talking in the sense, in the religious sense. I'm talking about your own energy, and how that connection and how that nurturing connection is transcending beyond actually what you're saying, whether be it verbally or non-verbally. So I really want you to think about that. And I want you to notice that if you want to have positive staff-child interactions, if you want to maintain, you know, good interactions with other people, well, you have to have good interactions with yourself. You have to take care of yourself. So I encourage you to take a 10-minute vacation, right? And this, or there's another strategy that you can do if you do have kids around, whether you are in a childcare program or at home. You can fill a cup, get a nice big glass of water, and find a comfy spot to sit, and let your children know that I'm just going to sit here and read, think, or breathe while I drink this glass of water. Explain that you'll be available once the glass is empty. So children have a difficulty because kids have a difficulty keeping track of time. So this is a concrete way that they can understand that this is, you're having a meeting with yourself. You need to take a few minutes to yourself. And really, if you love you, then you can have a better foundation to love and interact with other people. So that's a really important strategy to remember. Okay, and number 13 is having safe peer interactions. So I know that peer interactions with social distancing, this all is becoming very difficult. So I thought, let me just show you this picture. This is a picture of a preschool that invited parents to come in and have a party, right? To have a party together, but all maintaining social distancing. And they're all in the car, right? And they all had this beautiful picnic together. So this was a great way to plan safe peer interactions. But peer interaction doesn't always have to be physical interactions. It's helping children think about their peers. It's helping children think about their fellow classmates. It's helping them build that empathy. So there's building that love and that beautiful friendship, right? So that doesn't have to happen. That doesn't need to include physical contact all the time. So I wanted to share with you a quick example. I'm sure you've seen these cars all over the place, and a lot of the childcare centers have those, although they're not really remote controlled. So my son has, this is not my son, but my son is 5 years old, and he has one of these fun little remote controlled, opera or ride-on cars. So one way he's been really missing his friends that he hasn't seen since March. So one thing that he thought about was that he could take his car that by the way, he loves dearly, and he wanted to drop it off at his friend's house. So I know that the cars can be easily disinfected. So we took it and we actually dropped it off at his friend's, right in front of his friend's house. And that is him thinking about that and him planning those kinds of things that's peer interactions. That is building that beautiful friendship. So I hopefully we covered most of the standards within domain number 1. And I know that I had to kind of dash through them a little bit faster, but I wanted to just give you in this webinar what it means. You can still provide high quality, you can still meet high quality standards, and you can do them in a way that's safe, you can do them in a way that's manageable, in a way that's affordable, and in a way that you can, so you can still provide high quality programs in the midst of COVID-19. So that's the aim of the webinar today. So, you know, hopefully if you are interested, if you like today's session, then we will be going over the processes and going over the steps on how to obtain this kind of accreditations. We're going to go into a little bit detail next in about 2 weeks from now. So you'll be getting a reminder to come back for that session. And as like I told you before, if you meet all of the 64 standards, then you can apply for the Jodha accreditation. Jodha is part of a nonprofit organization based in the US. And I wanted to show you some pictures of programs that have received the 4 or 5 star quality. So congratulations to them. I also wanted to remind you that Arabian Child does have a complete, comprehensive play-based curriculum. A lot of the activities that we've mentioned today are in the curriculum, and there's over 100 plus activities, books, and frameworks. You can check that out on our website on how to get those. And something really exciting is that we will be launching our online learning academy very soon. So we have an exciting collection of courses that are now available online. We have helping childcare centers prepare for COVID courses. We have children's social emotional development courses. We have child protection courses. We have emergency management courses. We have all kinds of wonderful CPD courses that are on our online learning academy, and you'll be getting a link to how to access this online academy really soon. And that's it. So I think that we're going to pause here. I am going to look at my chat session to see if anybody has a question. So you can use the quick Q&A, or you can put it right into the chat if you have any questions or comments. I do want to remind you that we are providing a certificate for today's program. So there is a small fee for the certificate if you're interested. If you're not, then I'm so thankful to you for coming today. It was just wonderful having you. Thank you so much. Thank you. Thanks, Penny. Oh, yes, you'd like to know more about the toddlers with the stickers. Okay, I will put that in the email to send to all of you. Thanks, Naomi. Thank you all for coming today. I hope you enjoyed this short and quick session. Taru, yes, your concern for SEN children. Thank you. That's such an important topic. Thank you for bringing that up. So we're thinking about what webinars that we can plan for the upcoming weeks. And I think, Taru, you brought a very important topic that we'll see if we can address that. I know that's a really important topic that we need to talk about. Thank you for mentioning it. If there are any other areas of concern that you're kind of struggling with, you can put that in the chat. And you want the certificate, no problem at all. We'll be sending you an email on how to get that. Thank you, Carrie. Thank you all so much. Okay, I want to, we're going to be ending the session soon, but do send us, and I also want to remind you that if you go to our new website, we have a brand new website, and there's a small chat feature, a little chat box that pops up on the website. So by the way, we all of the team members in Arabian Child, we all get notified when you post something in that chat. It was nice to see you too, Penny, or not to see you, but to see you virtually, I guess, through the chat. So whenever you chat something on our website, we all get notified. So that's the quickest way actually to reach any of us. I can see every single message that you chat on our website, and so can everybody else on our team. So thank you, Sidra. Yeah, thank you. I hope to see you soon on our upcoming sessions. I know that last month we did our sessions only in Arabic, but this month and from now on, we're going to try to do in both languages. So I'm so thankful for all of you for coming today. I know this is such a stressful time for all of us, but I think that the only way we can get through this if we come back together, if we strengthen our relationships together, forget any nuances or things that may happen in the past. I think all of us need to open a new page and strengthen our relationship together in order to come out of this stronger. So I really appreciate all of you, and I hope that you will all continue to be connected with me, be connected with Arabian Child, and tell us how we can support you. So I really appreciate you. I want to thank you. Have a wonderful evening, and I hope to see you soon. Thank you so much.